Where PCOS affects 1 in 10 women, menopause is going to hit all of us. So it's good information to have out there. Hi, I'm Dr. Angela Mackay, chiropractor and naturopathic physician, and I want to talk to you about menopause. So menopause affects women usually in their 40s or 50s. The average age of onset of menopause or completion of menopause is around 52, but you can start having symptoms as early as your 30s. It affects every single woman at some point or another. Some women have a very easy transition to menopause, and this may seem astonishing to some of you women out there, but if you had an easy time going from childhood to puberty and your periods came on and it really wasn't too big of a deal, you didn't have a lot of problems, didn't have a lot of pain, sort of worked like clockwork and didn't really disrupt your life very much, the odds are good that when you reach menopause age, it will be no big deal. So for some women, menopause is a breeze. They just stop having periods and they don't have a lot of other symptoms and everything is great. Sometimes women will follow the same kind of track that their mother has followed. So if you have a relationship with your mother and you can ask what her process was like, then you can use that potentially as a guide for how it might go for you. In my case, my mom doesn't really remember when she went through menopause exactly, so ask now before your mom forgets. So common symptoms associated with menopause are irregular cycles. Some women start having shorter cycles every 20 days or so, and they may be light or they may be heavy. Some women have longer cycles, so you might skip a month here or there, or have longer cycles of 45 days or something like that. You can also get a significant amount of heavy bleeding. So for women who've had a lot of estrogen exposure, developing fibroids is really common, and those are growths that are in the muscle of the uterine lining, and they can be anywhere in the layers of that tissue, and that can lead to really painful, heavy periods. In fact, fibroids are one of the most common reasons that women in menopause age will have a hysterectomy. As you go through menopause, those fibroids will shrink over time and will calcify, and then once you've completed menopause, if you can make it through there without having to undergo surgery, those will fade away and become not problematic once you've completed menopause. The definition of menopause, though, is 12 consecutive months without a period. So once you've gone 12 whole months without a period, you have completed that stage of menopause, and then you're postmenopausal thereafter. Once you reach that postmenopausal stage, if you have any sign of a period or bleeding at all, that is a big sign potentially of cancer. Sometimes that can be benign, but it's definitely something you always want to get checked out. So if you have any bleeding after 12 months of having no cycles, make sure you go to the doctor immediately and get that checked out. Other symptoms that you might experience with menopause include hot flashes, and those can be really incredibly disruptive. I had hot flashes transitioning from the birth of my second child, and boy was I irritable. And you get hot really fast, you may or may not sweat, and it can be really disconcerting. It definitely takes away all of your focus and attention. The only thing you can think about is how hot you are, and in a lot of cases it can make you really irritable. Other symptoms can be night sweats or having hot flashes at night while you're sleeping. You can also lose your basic level of energy and feel really fatigued. You can lose your sex drive. You can start having thinning hair, thinning skin, weight gain. You can have vaginal dryness, which doesn't help your sex life either. And all these things sort of come together, and they can come in waves, or they can hit you all at once like a truck and be really problematic. Because of the hot flashes and the night sweats, sleep can be really disturbed. In general, your hormones changing can interrupt your sleep as well, and that can lead to more foggy thinking and brain fog and difficulty achieving everyday tasks. You can get forgetful and have a hard time there. So this can cause a lot of issues, both at work and at home. It can be hard to get things done because you're irritable and cranky, and it can disrupt your relationships with coworkers or family members. You may find that you're snapping more at your significant other or your children or people that are close to you that you care about, but have very little patience for. So it can be very disruptive on a personal, emotional level because you're feeling so uncomfortable that it's easy to lash out at the people around you. If you were to go to a medical doctor for this, the number one prescription is probably an antidepressant. And I just want to make sure that you understand that this is because your doctor is trying to support your nervous system so that it is less reactionary. We'll talk more about the hypothalamus pituitary adrenal axis, but your hypothalamus, which is in your brain, regulates temperature control as well as a lot of other body processes. And so when your doctor gives you antidepressants, it's not that he or she feels that you're depressed, but it is used as a tool to quiet down the hypothalamus and make it less reactive and tamp down the nervous response that leads to hot flashes and some of the irritability and other symptoms. Naturopathically, there's so much more we can do. So if you're not interested in taking antidepressants, we have a broad toolkit of things we can do to help with all the symptoms of menopause to make it more comfortable and more peaceful and an easier transition for you. And I like to get to know my patients and see what your goals are and find out how your body responds to things and come up with a plan specifically tailored for you and what your needs and goals are. If you have any questions, drop them in the box, and there'll be more coming up on menopause later.